testing, isolation, and quarantine of classroom contacts to minimize disruption to learning, mitigating this risk as far as possible with good ventilation and mask usage. Looking ahead, the numbers of infected people are going to be so high in many countries that schools may be unable to keep all classes open all the time due to a lack of staff. This winter, it is advisable to make arrangements for online learning alongside physical presence, so children can continue with their education when they are unable to attend school in person. In summary, the 5+1 pandemic stabilizers that have guided our response in recent months are as relevant for tackling Delta or Omicron today as they have ever been. These remain our mantra. Number 1, vaccination. Number 2, third doses or boosters. Number 3, increased mask use. Number 4, ventilation of closed spaces. And number 5, the application of new clinical treatment protocols. Plus, our overarching drive must be towards vaccine sharing and solidarity across age groups, sectors, borders, and political lines. Thank you.
Thank you very much, Regional Director, for your opening remarks. We'll go straight to questions coming in from the media now, and just a note as well. If you want to turn your camera on, it's also nice for us to see the people we are speaking to. So please feel free to turn your camera on when you ask your question. And also, I know we will be sending the Regional Director's statement to the press in short order. So without further ado, let's go to Corinne Gretler of Bloomberg. Corinne, please unmute your mic and ask your question.
Hi. So Spain is calling on Europe to debate the possibility that COVID-19 can now be treated as an endemic illness, and for it to be monitored kind of like the flu. Is that something that the WHO is debating as well? I mean, how likely is it that, it'll be changed from pandemic to endemic this year?
Great, thanks very much for your question. Regional Director, over to you to take it first.
Thank you. So, based on the preliminary data that we have as of today, what do we know of the Omicron? That there is a higher fraction of asymptomatic cases, there is a lower fraction of people necessitating hospitals, and that the death rates in hospitals are lower, that there is a very, very high spread of the variant with high prevalence in the communities. But because of the sheer numbers, due to the high transmissibility, we see that in several countries, the hospitals are having great challenges. Number 1, because of the number of people admitted, and number 2, because of the fact that healthcare workers are being infected themselves. So at this stage, the focus is on number 1, shield the vulnerable. Number 2, preserve the health workforce and their mental health. And number 3, to minimize disruptions to schools, health system, and the economy. So being in the middle of the pandemic crisis management, we have to be very careful with predictions towards the future. And one of the unknowns we have to stress time and again is the link, for example, with the long COVID. Thank you.
Thank you very much, Regional Director. Dr. Smallwood, if I may go to you to add, if you'd like, a little bit on endemicity and when this becomes endemic.
Thanks, Banu, and thank you, Corinne, for the question. I'm having a bit of feedback on my mic, so I hope you can hear me. In terms of endemicity, we're still a way off, and I know there's a lot of discussion around that right now. Endemicity assumes that, first of all, there's stable circulation of the virus at predictable levels, and potentially known and predictable waves of epidemic transmission. But what we're seeing at the moment coming into 2022 is nowhere near that. We still have a huge amount of uncertainty. We still have a virus that's evolving quite quickly and posing quite new challenges. So we're certainly not at the point of being able to call it endemic. It may become endemic in due course, but pinning that down to 2022 is a little bit difficult at this stage. I think we would have liked to have predicted that it would become endemic in 2021. All of this, of course, depends on how we respond to it, and widespread vaccination uptake and on an equitable basis will be very, very key in moving towards such a scenario. And we're still way off that as well. So at the moment, the conditions for endemicity are not being met. The virus is not settling into a stable rate of transmission. And there's still a lot of unpredictability. So we hope to see that very soon rectified, but it will very much depend on the actions we take collectively across Europe and across the world.
Thank you very much, Dr. Smallwood. We'll now go to Gunilla von Hall, Svenska Dagbladet. Gunilla, if you could ask your question, please. Thank you.
Yes, hello. Just put on my my video too. Can you hear me?
Yes, please go ahead.
Okay. Thanks for taking my question. In Sweden, the government introduced yesterday tougher restrictions. For example, restaurants have to close at 11 in the evening, 500 people max at sports events. And now political parties and the restaurant industry is very upset. They're officially stating we're not going to follow these restrictions. They are unproportional. They're too tough. So I'd like your advice in the situation where Sweden and other countries are. What are reasonable proportional restrictions? We have a quick spread of Omicron, but it's not leading to serious disease and hospitals are not overburdened. What is the right thing to do in this kind of situation? Thanks.
Thank you very much. Regional Director, if you'd like to go first.
Yes, thank you, Camilla. So I would like to repeat here that the strategy, whether it was Delta or Omicron, has not changed. It's the 5+1 pandemic stabilizers. So countries cannot boost themselves out of any wave alone, neither do it without the vaccines. It's a do-it-all approach, vaccination plus, full vaccination, boosting, masks, and now with the Omicron, high-quality masks, particularly in indoor settings, respirators, and for the vulnerable people. Number 4, ventilation, and if possible, countries who can afford it, CO2 meters, like in the classes. And number 5, new treatment protocols, particularly with new treatments coming onto the markets. And then, of course, the umbrella remains the solidarity that no country is safe without another country being not safe. And at the individual level, for a person who is boosted, it may be, in most cases, a bit more mild, yes, but we have to look at the population level, that there are still quite some pockets of vulnerable people who, among others, are non-vaccinated. So the key message is that every individual should do everything possible not to get infected in the first place.
Thank you very much, Regional Director. We'll move on. So we have quite a lot of questions coming in today. Sarah Newey, Telegraph, if you could ask your question, please.
Hi there. Thanks so much. My camera doesn't work, so apologies for that. But I just wanted to talk to you a little bit about, you've mentioned unvaccinated. Is there any evidence that restrictions on unvaccinated populations actually work, both in terms of vaccine mandates and imposing different rules on the unvaccinated, like lockdowns on those who haven't had a vaccine? Is that the way that we should be combating hesitancy, both in Europe, Eastern Europe, but also across the globe?
Thanks, Sarah. Regional Director?
Increasing the vaccination uptake is a top priority, and particularly addressing the vaccine hesitant people with the means that are legally and societally acceptable. But these measures, Sarah, differ. The outcomes of those measures differ in the different places. We cannot say that there is one size for all. It has to do with a lot of elements, including culture, historical, and how people are looking to it. The key issue is that to implement such measures in a dialogue with the community and to ensure that it does not increase public distrust and social exclusion.
Thanks very much. Dr. Smallwood, do you have anything to add on mandates for the unvaccinated and how effective they might be?
Thanks, Sarah. And I would just say that from WHO's perspective, in terms of putting in place measures in the broader community, we do not recommend distinguishing between vaccinated and unvaccinated groups, because that will go further in terms of exacerbating inequities in the population. And of course, we do know that even if you are vaccinated, you may be infected by COVID-19 and you may go on to transmit it. So we're not recommending those separations. But maybe Siddhartha, my colleague, can say something more about vaccine mandates.
Please, Dr. Siddhartha.
Thank you for asking that question, first of all. It's extremely important that we understand the reasons, as you have heard from the regional directors say. It's not one size fits all. So it's good to understand the needs and the concerns that unvaccinated population in every part of our region, in any countries, and also within a country, the different regions that we have. This, by understanding their needs, understanding their concerns, that is the way to make any decisions or policy, which is very much grounded on science, very much grounded on understanding the needs of the population. Any measures that the government or the ministries that we are seeing should be based on the local epidemiology, but also how we can improve the vaccination coverage in every part. It's extremely important that anybody, any concern that may have, should be addressed, because this is a health-seeking behavior of the population, and we need to be, considerate of that and make a policy based on it. So I think everything needs to be grounded on science and evidence. Thank you so much.
Thank you, Dr. Datta. I'm going to go to, we've received some questions in advance, and I'm going to take one from Camille from AFP. She asks, in some countries of the region, health officials have sometimes been quite optimistic despite the spike in the number of new cases. What's WHO's take on the return to normality? Could Omicron be the last wave? Regional Director.
Great to have you with us again, dear Camilla, and Happy New Year to you and to everyone connected. So this virus, as we know, has surprised us more than once. So looking at the past is not such a good measure to predict the future. The prime aspirational goal and resolution for 2022 is what we call to stabilize the pandemic. We do have the tools, it's possible, if they are applied everywhere and unconditionally. We do have a high-level expert group meeting every month to update those tools based on the evidence. How this virus has been behaving since the very start is that it builds up, then it surges drastically quick, it comes down, and every 3 to 4 months, there is another surge. But I believe that as an international community, we have become better in managing those surges, keeping the society running and protecting mental health. The key issue is to come up with a good plan to manage those surges timely with personal preventive measures, and their vaccination boosting remains important, the masks, then public health protocols at the community level, which may include temporary restrictions to people's movement in the midst of a surge. And then third, we cannot stress enough the equity in vaccines, which still remains an unsolved issue. Basically, we do have the tools, but we need to apply those.
Thank you very much. Let's take a question from our participants now. Nikolaj Skydsga, if you could unmute from Reuters and ask your question, please.
Yes, hello everyone. Thanks for taking my question. I wanted to dwell a little bit on the wave of Omicron right now. When do you expect this wave to peak, and do you expect it to peak sooner than the previous ones that we've had? And also, do you consider it to be peaking right now? Yeah, could you speak a little bit to that? Thanks.
Thank you very much. The regional director will start.
Yes, Nikolaj. You're right. We see a number of places where the peak is being reached or has been reached. It may be a little bit earlier than we anticipated, but remember, the region is very diverse. So we have to keep in mind the eastern part of the region, for example, the Central Asian republics, where this peak still may come. The key issue again here is to minimize the disruption. So shield the vulnerable. We have to shield the vulnerable, protect our health workforce, preserve the essential health services, and minimize disruption to schooling and the economy.
Thank you very much. Dr. Smallwood, would you have anything to add?
Thanks, Nikolaj. And just to add to the regional director's comments, the peak and the speed at which peaks will be met and come down will depend on a lot of different things, not just on the variant. It'll depend on the background immunity in the population, the vaccination uptake in the population, and how that impacts on the transmission of the virus. It'll depend also on the measures that are imposed in order to curb transmission, and that's not changed for Omicron. And of course, it will depend on the virus itself. And there's some very sparse evidence that might be suggestive of shorter periods between the generations of cases, but that's not at all confirmed at this stage. So it's better to assume that the virus is going to behave quite similarly in terms of transmission as previous variants have been behaving. And so that peak will happen at different times, in different contexts, and depending on the measures that are put in place at the community level and at the individual level.
Thank you very much, Dr. Smallwood. Let's take a question that we received in advance now from Oksana Naralenkova from Pravda. The question is, what is the data on the lethality of the Omicron variant in comparison with the Delta variant? So how much more fatal is the Omicron variant? Regional Director?
Yes, this is a question to be handled with care indeed, Oksana, because there is lots out, right? That there is a lesser mortality rate, for example, in the hospitalized people. But the truth is that we still need to see what's the impact of Omicron, for example, on the most vulnerable groups. And if we are reading, for example, that is a common cold, well, people don't usually get into the hospital due to a common cold. And we see in many countries an increase in hospitalizations. The key issue here is that the severity and the lethality can be drastically improved by implementing the tools we know are working. First and foremost, full vaccination, the boosters, then very important now in the midst of the surge is to increase the mask use and using high quality masks and making those affordable for the vulnerable people, the ventilation and new treatment protocols. Thank you.
Thank you very much. Let's move on since we have quite a few questions coming in. So let's take one from the floor. Donato Mancini from the FT, please ask your question.
Hi, folks. Good morning. Thank you so much for taking my question. My apologies for the lack of camera, which is not working. So, Catherine Smallwood said earlier that what might mean we move to an endemic phase is the predictability. Catherine, might I ask you to please elaborate further on that, because I thought it was really clear. What do we need to see to move into the endemic stage? And I wanted to ask you all, on new variants, I know the reports of the so-called Delta Cron have been shut down because it was a contamination problem. But is there anything on your radar currently that is concerning, such as perhaps, I have seen reports of a perhaps more problematic sublineage of Omicron in Scandinavia. Is that something that you have seen as well? Thank you so much.
Dr. Smallwood, over to you.
Yes, thank you for those questions. And very specifically on endemicity, and the way it's defined in epidemiologic terms is really based on stable transmission in a given population that doesn't rely on external forces being placed in order to maintain that stability. And that's where we're seeing that unpredictable level of transmission. Part of that is because of the virus continuing to evolve, and Omicron, of course, having specific partial immune escape means that we can't just sit back and see a stable rate of transmission. It causes epidemics and causes a very rapid increase in circulation of the virus. And so we can't call that an endemic state of disease. And that's where we really need to hold back on behaving as if it's endemic before it's actually, the virus itself is behaving as if it's endemic. In terms of new variants, and you mentioned this potential reports of recombination between Delta and Omicron variants, and indeed we are in touch with Cyprus, who have been providing information about that, and it does at this stage look likely to be the result of a laboratory contamination rather than a new variant or a new recombination between two variants. Specifically within Omicron, yes, there are several, two in particular, sublineages that we're following very closely, particularly in the European region. There's one sublineage, BA2, which over the past couple of weeks has spread quite quickly here in Denmark, and also to some extent in Sweden. And we're looking at the reasons for that, and investigations are ongoing here to look at both why it's spread quite quickly in the past couple of weeks. It might not be anything very significant. It might be simply because it's associated with one particular large outbreak or super spreader event. But we're looking very closely at the characteristics, and of course WHO at the global level continues to incorporate data on a weekly basis into our assessments of different variants as they emerge, in order to understand them, characterize them, and then designate them as variants of interest or variants of concern as necessary.
Thanks.
Thank you.
Thank you.
Thank you. Thank you for your question, and thank you, Dr. Smallwood. Let's go straight to Bursa Simsek from BBC Turkish. Bursa, please ask your question.
Hi, thank you very much for taking my question. Turkish health authorities, health ministry recently approved its own vaccine called Turkavac, and they said they have started initiatives in the frame of World Health Organization. I was wondering whether they have applied for the approval of the vaccine, and also, if not, what kind of initiatives they have taken and at what stage. And I was also wondering what kind of scientific evidence they have shared with who in regards to this vaccine. Thank you very much.
Thank you. We'll go straight to our expert on vaccines, Dr. Datta, on this, please.
Thank you. Thank you, Bursa, for your question. We are very much aware of the domestically developed vaccine by Turkey. I think, first of all, I think we'd really like to thank Turkey for taking that initiative. I think research and development has been one of the important parameters in this COVID-19 pandemic, and we really appreciate Turkey and other member states who are taking this initiative. We have learned about the phase 1 and the phase 2 completion of these domestically developed vaccines. We very much await the submission of these documents, in which will tell us about the efficacy and the safety of the vaccine. And also we are very much aware from the media news that the phase 3 trial of this domestically developed vaccine is undergoing. As we have seen for other vaccines, we really encourage Turkey to submit their documents for WHO's evaluation of the emergency use listing of the vaccine. And we will be very much keen to work very closely with the government and the Ministry of Health in relation to it. WHO updates their emergency use listing of the vaccines in their WHO website, and we would request you also to keep an eye on that, where all the status, including this, will be updated. So more to come as we receive the complete set of documents from the manufacturer and Turkey. Thank you so much.
Thank you very much. Can I quickly just follow up? So as far as I understand, Turkey didn't share the results regarding phase 3, right? Because Turkey has started applying the vaccine to its citizens. That's why I'm asking. Thank you.
Thank you so much, Bersa. So what we have learned, at least for the time being, is that the phase 1 and the phase 2 trials have been completed, and the National Regulatory Authority in Turkey has evaluated the safety and efficacy of the vaccine and have authorized its use within its own territory. We are, like I said, we are also aware that the phase 3 trial is ongoing. As you have seen for other vaccines as of date, several national regulatory authorities did make that decision on the use of the vaccine in their own country based on the phase 1 and phase 2 trial and moving into the emergency use listing of the vaccine. And we understand that at this point of time, based on the knowledge that we have, the similar process has been followed in Turkey. We look forward to receiving further information from Turkey on this process. Thank you.
Thank you very much for your question and for your response, Dr. Datta. We'll take a question here that we received beforehand, also on vaccines from Vasilieva Maria from Izvestia in Russia. And the question is, how resistant is this strain, so the Omicron strain, to vaccines? And is it necessary to tighten anti-COVID measures? We'll go first to the regional director and then to Dr. Datta.
Thank you. So we are following, as we mentioned before, vaccination plus approach. In that sense, it's a do-it-all approach. Not only vaccines or public health measures, we need to have the 5 stabilizers and show also the solidarity. There has been data that with the Omicron variant, the vaccine-induced immunity drops with the first and the second shot, but recovers by far after the 3rd dose. Why we continue to advocate for the additional dose, but not as a standalone measure, as part of the 5 stabilizers.
Thank you, Dr. Datta. If you have anything to add.
Thank you, Banu, and thanks for asking that question. Just to follow, where regional director left, I think it's extremely important, as you have heard from the regional director in his inaugural, in the opening statement, that he reiterated that the currently available approved vaccines are effective in preventing severe diseases and death. I think that is extremely important for us to keep in mind. The Omicron variant is new. We are closely following up with the countries for their research on the vaccine effectiveness of the vaccine on the Omicron variant. As we have seen from the data that has come from the UK and also in Denmark, there has been some reduction in the vaccine effectiveness with the Omicron variant. But as you have heard regional director say, that with the booster, there is some restoration of that protection. I think it's extremely important that we remember that we should effectively use the tools that we have on our hand while we continue to do research and development in the to provide better tools in the near future. So I think there has to be a balance in the use of the existing resources while looking for the newer evidence and also the newer tools to come through. Thank you.
Thank you very much. Let's go to Esmir Milovic, N1 Bosnia. Hi, Esmir.
Hi, Banu, can you hear me?
Loud and clear.
Okay, my question is on the situation in the Western Balkans. We know that some countries are basically recording the highest levels of infections at the moment. Also a question on testing. How successful are tests at the moment against the Omicron, and which would be recommended by WHO to be used to be most precise when it comes to the Omicron variant? Thank you.
Thanks, Esmir. Let's go straight to Dr. Smallwood on these. Thanks.
Thank you, Esmir. And as you said, some countries in the Balkans, namely Serbia, Montenegro, Bosnia-Herzegovina, are seeing very rapid increases in COVID-19 cases. It's very likely that that's associated with the more recent spread of Omicron in those countries, as Omicron spreads across the whole European region. And so what we'll likely see is a picture emerge of further spread as Omicron overtakes Delta, which is also still circulating in the Balkans at the moment. In terms of what needs to be taken into account, first of all, in terms of tests, it's our current assessment that the tests available for COVID-19, both PCR and the rapid diagnostic tests that have been listed by WHO, work well in detecting Omicron as well as other SARS-CoV-2 variants. In fact, Omicron has a very specific signature in PCR testing that can be used to measure and used as a proxy to measure how it's spreading. And so that's quite important. Now, it is possible, because there are lots of rapid diagnostic tests on the market, and we don't have all of the quality information about all of them, that some, I can't speak for all of them, but most of those that are in use in most European countries at the moment can detect Omicron, and people should take a positive test, whether it's a rapid diagnostic test or whether it's a PCR test, as an indication that you might have COVID-19. If it's a rapid test, you might seek confirmation through PCR testing. The most important thing here is that for anyone testing positive is for you to isolate immediately, because it's around the time when people first develop symptoms and when people first test positive that people are at their most infectious. And so isolation at that stage is really critical, and notifying any people who you have come in contact with within the past 2 days previous to your onset of symptoms is also really important, so that they can take measures to protect themselves.
Thank you very much, Dr. Smallwood. Let's go straight to Johanne Monte from RTBF in Belgium.
Yes, good morning. Thank you for taking my question. Sorry, my camera doesn't work. I have a double question. Some countries are now seeing a change of strategy towards Omicron, like Israel, for instance, with new priorities in testing and tracing. So my question is, should we now really give priority to the most vulnerable and let Omicron circulate among the least vulnerable? That's the first part of my question. And the second is, do we still have to give priority to COVID-19 patients in hospitals, or is it time to make no difference between emergencies?
Thank you, Johanne. We'll go to the regional director first and then to Dr. Smallwood.
Thank you, Johanne. So the point is that every individual and community, but individuals more and more now, because of the huge prevalence of infection in the community, need to do whatever it takes not to be infected, because there are too many unknown parameters still. One of them, the long COVID, which we really should not underestimate, is number one. Number two, remember the mantra, the more transmission, the more possibility for other variants. Especially now that we do have the tools. Then on the hospitals, it is true that the percentage or the fraction of hospitalized patients, not for COVID, but who are diagnosed with COVID because of the testing protocols, becomes higher and higher. So in some hospitals, we see a bit of a shift of the COVID patients from the ICU to the general wards. But again, the principle remains the same, that infection control is very, very important. We need to apply the tools and, of course, to really take care of the people with other conditions, which has been a challenge throughout. But the key issue that we see in the hospitals, and we anticipate in countries where the surge still has to arrive, is the health workforce, is really to keep the health workforce, which is overwhelmed or infected themselves. And that's what was my appeal in my statement, that governments and the public need to support the frontline workers, and we need to put mitigation measures in place to protect their mental health.
Thank you. Dr. Smallwood, anything to add there? Dr. Smallwood?
Sorry. I hope you can hear me. From the perspective of severity, and not to repeat the really on-point remarks by the regional director, but I wanted to make the point about severity. A lot is made about the characteristics of the virus of Omicron, particular in respect to its severity as compared to Delta, which, if you will remember, was characterized as significantly more severe than the wild type of SARS-CoV-2 that was circulating at the beginning of the pandemic. So we do have a slight decrease in the infection severity associated with Omicron as compared to Delta. But is that enough to justify and to explain what we're seeing in terms of a lot more milder infections? No. The reason we're seeing a lot more milder infections across Western Europe, in Israel, is because of the high vaccination uptake in our population. That immunity is basically meaning that we're able to tolerate, from public health perspective, a higher degree of infection in the population. And as much as we can tolerate that higher degree of infection in the population because of the vaccine coverage, we cannot necessarily tolerate the disruption that that's bringing to our critical services. The second point here is that we cannot generalize that scenario in all contexts. And in countries where vaccination rates are much lower than the very high rates that are present in Western Europe, including through booster vaccination, we cannot predict the same milder resurgence of cases. And we're yet to see how Omicron will pan out in a situation where there are more people susceptible and naive, immunologically naive to SARS-CoV-2. And that's where we need to hold our guns, be very cautious, and not jump to any conclusions about changing the strategy and letting COVID spread. That would be a grave mistake if it goes on to have very significant public health impacts in older age groups where we're yet to see the impact of the virus, and in communities where the immune systems are not as equipped as where we've first seen Omicron spread.
Thank you very much, Dr. Smallwood. Let's go straight to Mose Appelblatt, Brussels.
Yes, thank you very much, Banu. I would like to continue to ask some question about vaccination, which you already dealt with perhaps, but take first, let's say, the spread of Omicron. As you said, I mean, there is a surge now in almost all countries, but it might peak soon in 2-3 weeks. Is that also your prediction? And then the related question to that is, and that is linked to what Dr. Smallwood talked about the risk for severe cases and so on, and the high transmission rate. What I wonder is, if that high transmission rate, there's so many people being infected, I mean, is it possible to predict, I mean, how many will be severely ill and have to be hospitalized and also taken into intensive care? That might overwhelm the hospitals, right? And that brings me to my second question. I also would like to ask about the booster vaccinations, because I think you already mentioned that the primary vaccination, its effectiveness, it has been waning, perhaps already after 4 or 5 months. And now I think most countries in the European Union, at least, have started with the third shot already. Will start only after 4 months. But do you think, are there any indications that also this third shot, the first booster, has, let's say, will wane, I mean, its effectiveness, so there will be a need for a fourth shot, which already been given, for example, in Israel? And that, I think, also related to the previous questions about that we can't see any, let's say, change from a pandemic to epidemic during this year. So there might be need for recurrent vaccinations. What is your opinion about that? Thank you.
Thank you, Mose. Well, I think we'll go straight to Dr. Smallwood, if I may, on some of these points. Some of them have been covered. We've discussed the peak, etc. But Dr. Smallwood, if you'd like to add, please.
Thank you, Banu. And Mose, your questions are quite extensive and really good questions. And perhaps my colleague Siddhartha might be able to say something more about what we expect to see in terms of the vaccine strategy in the longer term. But I wanted to comment a little bit on the questions around what we're seeing specifically with Omicron in terms of severity, and this is on the basis of a subset of case level data that gets reported to WHO Europe on a weekly basis from member states, and bearing in mind this is still initial data, but this is based on approximately 30,000 cases that are reported to WHO. And yes, we are seeing a lot more milder cases, as I said before, because this is predominantly moving through a population that is already protected either through vaccination or through prior infection at the moment in Western Europe. But even within those cases, we are seeing a majority showing symptomatic disease, a range of symptoms from mild to moderate symptoms. And that's at approximately 89% of the cases that have been reported to us. So a very significant majority of cases remain symptomatic. In terms of those cases that go on to be hospitalized, we are still seeing a number that is approaching 1% of cases. That means one in every 100 cases will still go on to be hospitalized. And that's not so different to what we were seeing for other variants. However, as the regional director highlighted, we're seeing early data and early reports from hospitals that even once hospitalized, the progression to requiring ventilation is less with Omicron. And that's that's an important point. But we are still seeing hospitalizations. We're still seeing a lot of people sick. And so it's very important that even within this highly protected, vaccinated population, that we understand that the disease COVID-19 can still be serious. And so I think this is where we need to be very careful about jumping to conclusions too quickly and taking the next weeks to really, as we've done in the past, say when we're making decisions on strategy that may lead to an increase in cases, that we proceed cautiously and on a stepwise manner on the basis of continuous risk assessment. And that would be the principle moving forward, not to lift everything and jump to conclusions. We can be very optimistic that this might bring a new phase of the pandemic, but we're not quite there yet, and we're not confident in saying to move forward in that manner.
Dr. would you like to add?
Thank you. Yes, thank you, Mose, for that part on the vaccination as you connected. But I think let me reiterate a couple of things here. The first thing is that WHO still recommends that every country need to ensure a very high uptake with the primary series or primary doses. As you see, as of date, around 60% of our region's population have completed their 2-dose schedule, which means 40% of our region's population haven't received a single dose. I think that's quite important parameter. You have heard Regional Director highlighted in his inaugural words that we still need to have very high primary cities coverage, plus moving on to the booster. The booster vaccination program was the technical advisory group of experts in our region have looked into the need for the booster. And I think it was highlighted because of the high transmission in the WHO European region, plus the early evidence and waning of the immunity from the vaccines that we are seeing. The vulnerable population group, again, was requested to be prioritized by each and every country. The essence of this entire booster or the primary vaccination program is to protect the vulnerable. We know where the virus hits, and I think we have learned it from the last 24 months. So this should be and remain the main essence of any vaccination policies or strategy moving forward. There are several unknowns. We are aware of it. And I think the vaccination program and the vaccination strategies as WHO has been working with our member states were defined on making provision for the newer entity by learning from what we have seen until date. So I think it's not an issue of only knowing which new vaccine would come, but I think it's also important that we effectively make use of the vaccine doses which are available, so that the vulnerable population groups, the population which are still left unattended in each and every country, are being reached as soon as possible, both with the primary dose series and also with the booster in long run. Thank you.
Thank you very much, Dr. Datta. Let's go straight to Jérémie Lanche from Radio France Internationale. Jérémie.
Hi, can you hear me?
Yes.
All right, thank you so much. Just a quick one. There's a word that the governments and obviously the population in Europe don't like to hear, is the word lockdown. The Netherlands are experiencing one right now. It could be reinforced, as I understand, by the end of the week. Given this tidal wave that we're in, and given what Dr. Smallwood said about not making any difference between vaccinated and non-vaccinated people, I was wondering, should lockdowns be completely put aside in Europe, or is it something that WHO is ready to consider? I mean, are we done with the lockdowns or not?
Let's go straight to Regional Director on that one.
Yes, thank you, Jérémie. So I think in the beginning of 2020, the lockdown was basically a shutdown. The whole world economy came to a standstill. Since then, both as a community and governments, we learned to apply tools to have a fine balance between life and livelihood. So in that sense, if the pandemic stabilizers are being applied, there wouldn't be a need for a lockdown. But one of the challenges have been that too often countries thought that the pandemic came to an end, when in reality it was just another tidal wave passing. So lockdowns, just like mandatory vaccination, should be tools of the very last resort, temporary. In some extraordinary situations, it may give a little relief, particularly to prepare the health systems. But of course, everything should be done to try to avoid lockdowns. If they are, for example, locally applied, then there is a responsibility to take care of the mental health of the people, to put measures in place to detect and prevent domestic violence, including intimate sexual violence, and to provide microeconomic support to the most affected.
Thank you very much, Regional Director. I think we have time for another question. It's Stefano Valentino, who doesn't have a mic, so has sent his question via the chat function. The question is, while Dr. Hans Kluge recommends European countries administer boosters to their entire population, Dr. Tedros from our international office in Geneva officially stated that generalized boosters are not a way out from this pandemic. So in short, he would like to know if we could clarify whether there are diverging views around the third dose between the Europe office and the international office.
Thank you very much. We do not see any contradiction over there. I think the spirit is that until and unless there is vaccine equity globally, we are not going to get out of the pandemic. And the vaccine inequity is still glaring. But it is not one or the other. It's a do-it-all approach. And I think our continent is a front runner in sharing vaccines, although much more needs to be done. Also in putting up technology in South Africa through a new mRNA hub for the vaccines. But since the beginning, indeed, the WHO Regional Office for Europe for the Pan-European region has been advocating, based on the science, for booster doses, which, as you see, for the Omicron in particularly is very important. But again, the point here, not boosters alone. There is no country which is going to boost itself out of the pandemic. It needs to be ingrained in all the 5+1 pandemic stabilizers.
Thank you very much, Regional Director. on this note, let me thank everyone and close the press briefing for today. Many thanks, obviously, to Regional Director, but also Dr. Smallwood and Dr. Dutta for their time and for their expertise. And thank you to you, members of the press, for joining the press briefing today. If you need additional follow-up, and I know there's a few of you that have some follow-up questions, and I'm sorry we weren't able to get to them, please contact us by email using the details that were provided in the invitation. We will get back to you with answers. As always, stay healthy, take care, and once again, Happy New Year. Goodbye.